We're going to have a very relaxed conversation here. And the reason why we're going to have a very relaxed conversation here, do you guys want to know why we're going to have a very relaxed conversation here? Because right now we are in a state of emergency. We have 65 people in our emergency department and we only have 19 beds. We have people laying outside on the ground in the hospital. We have people laying on the floors. We are overwhelmed. It is something I've never seen in my life. I'm an OB-GYN and I've already been called 5 times to the ER to assist in the ER. We have 40% of our staff is out sick with COVID and it's a scary situation. So we are in a state of emergency and I've never seen anything like it. So tonight, Dr. Rita is going to have a really light conversation with you guys because we have some urgent things going on here at the hospital. So let's have a quick conversation about CBD. I have moved some of you over to the panelist side, but I can't see my slides. Let's see. And for all the guests on the line, I just want to introduce myself formally. I'm Dr. Rita McGuire, the Chief Medical Officer and one of the co-founders here at Wakana. And this is typically on Wednesday night, what we do is we talk about a certain condition. We kind of tie it all in with CBD, but tonight we're going to talk about CBD, and then I'm going to pull as many of you over to the panelist side so you can ask me some really direct questions, okay? If that's fair, hopefully that's fair, and if I get called out, I'll have to leave, but hopefully I won't. So I do want to introduce you to our medical advisory board. Apparently, we are still missing 3 healthcare professionals. So we've got to add them in before Saturday, before our health conference. But these are professionals that are business partners here at Wakana. They are nurses, doctors, chiropractors, dentists, clinical psychologists. We have a pharmacist. We have also naturopaths. We have registered nurses. We have nurse practitioners. The only thing we're missing are veterinarians. We are looking for veterinarians because we want to offer our pets CBD as well. So if you're out there, you know some veterinarians, please let's recruit them so they can help us with some amazing, incredible formulations for pets as well. A little bit about myself. I'm a 30-year veteran in OB-GYN. My first love was emergency room medicine, and I'm telling you, the ER doc on tonight, he's pulling on me. I put in Foley's, I've drawn blood, I put some IVs in. You know, that's not normally what I do, but you know, when you're in a state of emergency, you've got to help out where you are needed. I attended Wayne State School of Medicine in Detroit, Michigan, came back here, did my residency, and truly am also an entrepreneur. I own about 4 companies now. CEO of RJM Wellness and RITA Fitness, own a gym in South Florida, own a COVID mobile testing unit, and also one of the co-founders here. I am a global women's health and wellness speaker. I'm one of the certifying physicians for medical marijuana here in the state of Illinois. I'm also a member of Doctors for Cannabis. So yes, I'm an advocate for this plant. I've seen this plant just really help hundreds and hundreds of people. And so it is absolutely an alternative for those who are looking for a more holistic way of addressing their health, right? Holistic, meaning mind, body, spirit, the whole body. I'm also in school, will be getting my MBA very soon and I am a certified trichology instructor. So I'm doing a lot with hair loss, alopecia, in one of the beauty schools here in Chicago. These are my 3 amazing children. They all have birthdays. They're all Capricorns. Jacob is the oldest. Right now he's in Lake Tahoe skiing for his 31st birthday. Joshua just got back from Cancun. He just turned 26. And then the 24-year-old just got back from Montreal. She's 24. So they all have birthdays in December and January. So yes, I'm still a practicing physician. I'm still doing surgeries and delivering babies. Many of you know that I was on the news for Christmas and New Year's because literally I have been at work forever because again, we're short because of COVID. We're so short staffed, but I was able to bring Christmas babies and New Year's babies into the world. So still practicing, still advocating for the cannabis plant. I was testifying in front of the Judiciary Committee for the legalization of cannabis. So the governor asked me to speak for that. So pretty amazing times in the cannabis industry. But let's talk about why cannabis is so mainstream, because many of you on the line know that CBD is part of the cannabis plant. And if you're on the line and you don't know that, you're going to learn it in about 2 minutes or less. But because Dr. Sanjay Gupta actually came out and made a public apology about being misled about this plant, you know, he said that he didn't dig deep enough into the research and the studies that have been done in Europe about how this plant can be an alternative for health. He, like many doctors, I'm not one of them. You know, I've always been a doctor that when my patients come to me and they want to take an herb or they want to do some sort of alternative method of treatment, I'm always open to it. I've always been, my 30 years. But what I would do is that I would research what they wanted to take, right? Because we do know that herbs and alternatives, they can interact with your medication. So Dr. Sanjay Gupta, after traveling the world, after speaking to scientists and lab specialists and experts and patients, right? He found out that there were so many people around the world, not in the United States, but around the world that he hadn't spoken to that had gotten results by using cannabis, by using CBD. And so from there, it exploded. I mean, people were really wanting to use cannabis in many forms to address their health. But still, you have many physicians. You may be on the line and maybe you've had a conversation with your own doctor and they're like, absolutely not. And the reason why they're saying absolutely not is because they don't know anything about the cannabis plant. The reason why they don't know anything about the cannabis plant is because we were not taught this in medical school. And still, 2022, less than 5% of medical schools are teaching about this plant, teaching about the medicinal benefits that this plant offers. So when we look at the cannabis plant, it's important that you know that we're not trying to get you high, right? Because that's the first thing that may come to mind when you hear the word cannabis. But what's very important that you understand is that there's 2 species to the cannabis plant. There's one species that gets you high, it's called marijuana, and there's another species that gives you the health benefits without the high, and it's called hemp. And the difference between the 2 species is that one, marijuana, has a high level of delta-9 THC. Delta-9 is the compound that gives you the euphoria, the paranoia, and maybe even the munchies. Whereas hemp has very small amounts of delta 9 THC. In fact, by definition, hemp is defined as containing less than 0.3% of THC. So yes, you have two different species coming from one family, the cannabis plant, one giving you the high and one giving you the health. So tonight, we're going to concentrate on hemp. We're going to concentrate on all of our amazing products that are extracted from the hemp plant. So one of the major compounds that's extracted from the hemp plant is CBD. That's why you see CBD highlighted with all of its benefits. You know, CBD can help the body to be in such homeostasis or balance that many people say that when they use CBD and they have anxiety, they feel better. Their anxiety is lessened. So lots of people through research that have had pain, have had inflammation, that have had symptoms that we see in those who have autoimmune conditions like lupus and fibromyalgia, and they've gotten results and relief because CBD is an anti-inflammatory. It is an anxiolytic. It helps to reduce seizures. It helps to normalize blood sugar and blood pressure. It helps us sleep. It helps to improve our mood. It helps to reduce the incidence or risk or incidence of cancer cells from metastasizing. So as a whole list of great things that it can do for the body, along with other compounds that the plant makes. You know, there's compounds like CBC and CBG and CBN, and yes, they don't have as many medicinal benefits as CBD, but when you combine them all together, they have a synergy on the cell, on a cellular level that really helps people who have challenges. And the way that CBD and all the other cannabinoids work in the body is through a very vital regulatory system called the endocannabinoid system. Now, this system is present in every single one of us. In fact, this system is present in animals like dogs and cats. That's why we're looking for a veterinarian. So if you know a vet that's interested in holistic ways of healing, please send them my way. So the endocannabinoid system has receptors in the body. The main receptors are CB1 and CB2 that bind with CBD and other cannabinoids when you consume it to put the body in balance. So when we talk about balance and we talk about homeostasis, this is why when you have inflammation, or this is why when you have anxiety, when you consume CBD, it really does help to bring the body back into balance. When we talk about the brain and the central nervous system and the immune system and the periphery, these are major systems that are looking for CBD and THC to put it back into balance. So let's talk about some of our products. Our products are amazing. They are all certified. They all undergo additional validation and testing to ensure there's no mold, mildew, heavy metals, pesticides, or residual solvents. It's important to note that the FDA does not approve of any of these statements, meaning that we can't make claims. We can't make any diagnosis. You know, if you're under a doctor's care, if you're on medication, please, please speak to your physician before you start taking CBD. It's not that you can't, but I'm telling you, I've taken care of enough patients, enough family members, enough friends that when they use CBD and they also happen to have high blood pressure, we have noticed that their blood pressure has improved. So you want your doctor to know why your blood pressure is improving, right? So you want your doctor to know that so that they can be on the lookout to start decreasing some of your medications. Now, another thing I always teach is that when you're using CBD, start low and slow. If you take too much CBD initially, too fast, too soon, what happens? You may have some minor side effects. You may have some extreme drowsiness. You may have some lethargy, upset stomach. You may be a little nauseated. You may have a little diarrhea, but you won't die, right? You will not die. No one has ever died from consuming cannabis, even on the THC side. It may feel like you're going to die when you take too much marijuana, but you will not die. And the reason why you won't die is because there are very specific receptors in the medulla. That's a part of the brain that has receptors for opioids like fentanyl, those drugs that if you take too much, you will die. Well, those receptors are not present for cannabis. So cannabis is a plant where you will not die, okay? So even at doses of 20,000 milligrams of CBD, nobody would take that much CBD. It is not lethal. It may be a little toxic to your body, but not lethal. So the reason why we say start low and slow is because the Mayo Clinic did some research. And what they did is they looked at people who have chronic, severe, debilitating pain. And what they found here in the chart is that those with chronic pain only needed a little bit of CBD, 2.5 to 20 milligrams of CBD with or without THC. So more is not better, even if a person has chronic long-term pain. Now, the way that CBD works is different in everyone. So I may need more CBD than Skinny Minnie, right? Because I weigh more than her, my body chemistry is different, the way I metabolize is different. So there is a range of where you may need and feel relief on CBD than I. So start low, go slow and low until you hit that sweet spot, that spot where you're starting to feel the results. This is the FDA disclaimer. We already said that. I want you to meet some of the partners that are testing our product. The lab is in Davies, Florida. I'm in Florida because I have a camp there once a month. I frequent the lab. It's called Green Scientific. They're one of the top ISO labs in the state of Florida. They do our third-party validation. They also provide us with certificates of analysis. So all of our products do have this certificate that allows you as a consumer to see the potency, to see that our products are free from mold, mildew, heavy metals, pesticides, residual solvents, et cetera, et cetera. We even do terpene testing. You know, our full spectrum products do have terpenes. Terpenes are what give the cannabis plant its aroma, and terpenes have medicinal benefits as well. So all of that is in our certificates of analysis. Now, our products are products by industry. Our formulators are very smart in really identifying products that top industries offer, right? And we've enhanced these products with CBD. So we have a whole line for weight loss, a whole line for wellness and immune, a whole line for hair care. Remember, I'm a certified trichologist now, and I do a lot of teaching in beauty schools to really address alopecia, right? Hair loss, hair thinning is a global pandemic. People all over the world are losing their hair. Why are they losing their hair, Dr. Rita? Well, they're losing their hair for several reasons. One is COVID. COVID hair is real, right? A lot of people lose their hair in COVID because whenever you have a stress on the body, it causes a temporary hair loss called telogen effluvium. So we see a lot of hair loss right now. Number two reason for a global pandemic with hair loss, we're seeing more people with chronic disease states. We're seeing more people with diabetes, with thyroid disease. All of those chronic disease states compromise blood flow to the scalp, which nourishes the hair follicle. So the whole hair care is a big industry, and we've really made an impact by using CBD to address hair loss. Essential oils, we have a whole line of essential oils. Our organic essential oils are amazing. Our skin care, we know that our skin is the largest organ in our body. So we have a facial serum. We also have other products that we'll talk about, edibles and topicals, but let's start with our tinctures. Our tinctures are products that you place underneath the tongue. Now let's say that you may want to ask the question right now, and I know what the question is. The question is, Dr. Rita, what makes Wakana products different from other products that I see out there? Because I see a lot of products out there, Dr. Rita. What is the big deal about Wakana products? Well, I'm going to tell you. Our products have proprietary formulations that are very, very unique only to Wakana. We use not only the raw material that is sourced from organic farms in Oregon and Colorado, but we also enhance this organic raw material with essential oils like black seed and turmeric and peppermint. See, these essential oils, when formulated with CBD, only enhances the incredible benefits of CBD, being an anti-inflammatory, being an antioxidative powerhouse. When you combine that with turmeric, that is a super essential oil in reducing inflammation and improving brain health and heart health. You combine that with black seed, that is a super essential oil that assists with digestion. Black seed helps to reduce inflammation. It helps with hair growth. It also improves the ability of the pancreas and the cells of the pancreas to produce more insulin. So really good for that type 2 diabetic and even that type 1 diabetic. So this is what makes Wakana unique, is that we have proprietary formulas on our products that enhance the ability of CBD to be even more incredible on a cellular level. So we have our Hempranium 500, 500 milligrams of CBD in a 15 ml bottle. We also have a water-soluble product that you can put in water, juice, coffee, tea, anything liquid. We have our Hemp MD, which is our therapeutic tincture. This is one that we recommend for those who have more severe challenges in life, right? It's more milligrams, 900 milligrams. And then we also have what we call our pure product. Now, when you see a white label versus a black label, when you see the word pure versus the word power, that will distinguish those products that are full spectrum versus broad spectrum. So a full spectrum product or a power product uses the entire plant and has the legal limit of THC, which is 0.3%. Now, it won't get you high, but it has the legal limit. The broad spectrum product, which are pures in the white label, those contain less than 0.0% or less of THC. Those are products that you want to take if you have random drug screens at your job. So all of the products are amazing, but we do have products to offer those who have random drug screens at their job. But again, I recommend you start low, you start slow. You don't need a lot of CBD initially, otherwise you'll have some of those minor side effects. Let's move on to our topicals. Now, our topicals offer local relief to those sore, achy muscles and joints. So our number one seller in our company is called our Extreme Power Pain Cream. That is our number one seller. Our number two was that Hempranium 500 tincture. So these topicals will not pass the blood-brain barrier. So even though they say power, and we just talked about power means full spectrum, containing the legal limit of THC, because it's a topical, it will not pass the blood-brain barrier. It's safe for you to take if you have random drug screens. So we have a power cream, and then we have a liquid. The liquid relief, or Dr. Rita's rub, is also very amazing. But again, what makes your topicals, Dr. Rita, so special? Why can't I just go to the health food store or the gas station and get some cream? Well, again, we have proprietary formulas on all of our products. That's what makes Wakana products unique. Our topicals are also infused and enhanced with essential oils that improve the quality and the ability of CBD to reduce inflammation and pain. We also have what we talked about earlier, that facial serum. That's our Holy Glow. It's great for those who want to keep those wrinkles away, right? And keep the aging and glowing going on our face. So incredible topical products that you can use to address inflammation and pain. Our edibles include gummies. They include our Flat Belly Brew. We have gummies, again, for those who have random drug screens. We have gummies that are full spectrum. We have gummies that are needed for those who have issues with their libido, their sex drive, their stamina. We have gummies for those millennials. They love our Delta 8. Delta 8 is another cannabinoid that really gives the intensity that CBD doesn't have. It gives that potency that CBD doesn't have. So if you're looking for a little bit more you're going to want that Delta 8 gummies. The millennials love it. All three of my children love the Delta 8 gummies. Our Flat Belly Brew is, again, a product that is infused with CBD, that is a full spectrum CBD. So if you're looking for a great coffee and you have random drug screens, this is the coffee for you. It helps to improve your energy, it decreases your appetite, and it helps to suppress those cravings. The gummies vary in dosage. So we have a dosage and a formula for you. Now our smokables, right now we're only offering one smokable. It's a Delta 8 pre-roll. We will hopefully have new smokables in, but just know that smokables act quickly. Within 1 to 5 minutes, in using a smokable 1 to 3 pulls, you will feel the effect. I personally love using smokables for my friends, family, and patients that smoke cigarettes. I'm naive. I didn't even know people still smoke cigarettes, but yes, people still smoke cigarettes, and we want to get them off of those cigarettes. CBD will block the craving for nicotine. CBD will block the withdrawal symptoms when they're coming off of nicotine, and CBD will absolutely help those who are looking for a smoking cessation sort of product. These are also great for those who are out there that have anxiety or need to get to sleep or have an inflammation and pain. Our sexual health products, again, include that King of the Jungle gummy that can be taken by men and women. We have sensual body butters, and we do have CBD lube. We do have them in stock. Our culinary products, we do have the spices in stock. If you're a distributor partner, a business partner, and you have guests on the line and they want those spices, they just need to call customer service. We have a vegan butter, all infused with CBD, as well as a culinary oil. Our culinary oil, I think I forgot to put on there, but it is an oil that you can marinate your salads with, you can cook with. It's got a grape seed as the carrier oil. It's an amazing oil. We talked briefly about alopecia, a global pandemic. Folks are losing their hair from stress, from anxiety, from COVID infection, from chronic infection. We have a system that includes shampoo, conditioner, leave-in detangler. I love this product. So we have so many great choices. You can't go wrong. We've got a product for everyone. I'm going to stop sharing my screen, and I do want to bring over some folks. So if I promote you to the panelists and you want to ask a question, come on over, unmute your mic, ask your question, or you can put it in the chat. So in order to get on the panelist side, you have to accept my promotion. If you have a question, put it in the chat. If you are a guest, we would love to hear from you. I would love to find out who invited you, and you can ask your question. Any questions?
Hi, Dr. Rita. It's Ernestine. How are you? You look beautiful.
Gosh, thank you so much.
So I asked the question. I put it in the chat. My brother is a chain smoker. He smokes a lot, but his job, he's randomly drug tested, so he refuses to take the smokables. So I don't know what to do at this
So
point.
he couldn't take the smokables. If he has random drug screens, he would not be able to take a smokable. He can use the pure tincture and the pure gummies. Absolutely, that will take that edge off. That will help him to reduce those cigarettes. The pure tincture twice a day, and I would absolutely use the gummies, the broad spectrum gummies, 2 to 3 times a day.
Okay, sounds good. Thank you, Dr. Rita.
You're welcome.
I have one more quick question, and I'm going to stop talking.
Oh,
one
no.
of my good girlfriends, she is very interested in the cleanse, but she's nursing. So that was my question on the other call, and I didn't ask it soon enough.
Yeah, no, I wouldn't recommend the detox cleanse while she's breastfeeding. I would personally let the breast milk establish itself. So how old is the baby?
That boy is almost 2 years old. So
oh yeah, she can do it.
Okay.
Oh yeah, I thought there was a newborn.
No,
yes, she can detox.
Okay, perfect. Okay, I'll let her know. He'll be 2 in April, so
absolutely yes.
All
Yeah,
right.
whenever a mom is breastfeeding, we always recommend for the breast milk to get established before you start doing. But a 2-year-old, oh yeah.
All right, thank you.
You're welcome.
Hi, Dr. Rita.
Yes, hi.
This is Doris.
Hey, Doris, how are you?
I'm much better. I had a bout with COVID.
Oh, I'm so glad you are much better.
Yes, I'm through the most serious part. Thanks. And I'm so grateful for our products, because the hemp MD and what I had to spray up my nose, all of that gave me
first defense.
Yes, gave me much peace. But I wanted to share with the audience regarding neuropathy. That is what I really suffer with. And the doctor told me I had the sock syndrome, which, you know, all my feet always seem tight. But since I've been religiously using the extreme pain cream, that has given me so much comfort at night. I rub my legs, deep rub every night with the pain cream, and it really helps me to sleep along with the gummies. And I am so grateful for Wakana, because I had no relief. And if you ever had neuropathy or know anybody who suffers with it, get them on the pain cream and the gummies. It really helps.
Which gummies are you using? I didn't
use all of them. I use the Delta 8. I go from one to the other. The power, I tell them, they be teasing me, my kids especially, Mama, you doing drugs? I say, look, our mama is doing what helping mama to sleep good, relieve of this pain, and no side effects. That's what mommy is doing.
I love it. I love it. So your children, I'm so glad, are witnessing that you are getting relief from these products. And that's what reminds me, Doris, to share with you and others that when we started in this business, my 3 children said, nobody wants that CBD. They want marijuana.
Exactly.
My children literally fight over our gummies.
Yes.
They fight over our gummies because they understand that now they have a product that they can use and not be high.
Yes.
They have a product that they can use for their anxiety and not be high.
That's what I was going to say. Anxiety is another thing that gets me. And the gummies, I only do a half a gummy for my anxiety. And it just really calms everything down. It's amazing because I was one person that was against all of this many years ago. And now it's like, bring it on. They say, you do the power. I say, I do the power. I do the Delta 8. I do all of it. And I'm excited. And the hemp powered hair. Now that is my baby. I am so excited about that because I had CCCA and my hair is back, you guys, in the top. And I tell people, there are no guarantees. We don't guarantee, but from the testimonies, and I'm a product of the product, it works. That's all I can tell you. It works. Give it a chance. And don't be looking for microwavable results. It takes a moment. Hair only grows 6 inches a year. So you know, and I'm now in testing again because I fell and ended up with an injury to my head, and my hair is out in that area. I sent a picture to Kathy because we're going to journal as we go in hemp powered hair. You guys will see it. I'll show you as we go along, but I'm sure my hair is coming back, providing that the follicle didn't die in that process. I had a really bad fall.
Wow.
Yeah, I actually passed out. Yeah, I don't know.
Oh, I remember. I think you told me. Yes.
Yes. So now they're trying to find out why, but hemp powered hair is going to bring my hair back, provided my follicles I did not lose the follicles in the process.
Amen. Oh,
Thanks,
wow.
Dr. Rita, for being such an awesome leader in the medical world. I am so excited that Wakana is doing what it's doing, what they're doing. You guys are amazing.
Well, thank you so much, Doris, for all that you do. Doris is our trichologist here at Wakana, and I've learned so much from you, and I'm just loving the field of trichology as well. And our products are amazing because, you know, with CCCA, right?
Yes.
Many times that can cause some scarring, and
yes,
it can be a difficult one, but our products really have been incredible and really have helped that follicle to come back. So praying for you. I am so grateful that you're feeling better, and I look forward to seeing you in the spring, right? I'm coming to California.
Yes. Provided we don't have to cancel. I'm so nervous about this virus.
Right.
Yeah, and it's no joke, you guys. I'm not telling nobody to get vaccinated, but I do believe if I had not been vaccinated, I would have had a much rougher time getting through the 14 days I had a quarantine in a hotel. So that tells you right there, financially, it wasn't cute.
Absolutely. Great. I'm so grateful you're better. Thank you, Doris.
Thank you, Dr. Rita.
Any other questions?
Hello, Dr. Rita. This is Monica. Thank
Hi,
you so much
Monica.
for all of the information that you give us and you share with us whenever the opportunity presents itself. I have a friend that I sent she was having hot flashes, and I sent her samples of the black seed oil, the tincture, just little samples, and some pure gummies. I think maybe a pack of the pure gummies, and she said they didn't work. And she was going to do some type of harmony therapy. I've never heard of that. And I told her I would try to get some more information to her to see what else we might be able to help her with the hot flashes.
Yeah, so hot flashes are a result of the estrogen and progesterone from declining and the ovaries just not working anymore, which is natural as we get older. So when we recommend our products to people, you've got to be very honest and let them know that they really need to give the CBD about 3 months. You know, people are really quick to say, well, this didn't work. Well, when you are dealing with more chronic long-term conditions, you're going to need much more than black seed and gummies. So for someone who has hot flashes, mood swings, menopausal, I would recommend for them the Hempranium 500 milligrams. I would recommend twice a day, 3 drops twice a day. Midday, I would recommend a broad spectrum gummy. And then at night, I would recommend a power gummy. Now, I would also like to know, what is her weight like? Because what I find in those, I'm 59, and I really notice that I don't have hot flashes or symptoms of menopause unless I am bad and I consume sugar, right? I consume those bad carbs or those hidden sugar. Like, I don't eat sugar, but you know what type of sugar I mean. So I would look at, what is her nutritional status like, right? Because if she's overweight, if she is eating a lot of processed food, I would really have her to do our 21-day detox, our raw detox. And then after that, I would put her on that regimen that I just spoke about. Are you there, Monica? Did she leave?
No, I'm here. I had trouble
Oh.
unmuting.
Sorry. I was like, did I make her mad?
Oh, thank you so much. I'll relay that information to her. Thank you so much.
Yeah, everybody on the line, if you are, even if you're a guest, but this is really for our business partners. I can't think of anything. I can't think of one thing where you would recommend like one product. It just doesn't work. What you want to achieve, you want to achieve a steady state of CBD in the bloodstream. So I think you said you gave her some black seed and a gummy. That's just not enough CBD in the bloodstream over a 24-hour period to really help get the body in balance. And that's what we're trying to do, ideally. We're trying to decrease inflammation. We're trying to get the body back in balance, because in 99.9% of chronic conditions that we're dealing with our health, it's a result of inflammation, diabetes, diabetes, high blood pressure, heart disease, obesity, asthma, arthritis. All of these chronic conditions, you can name more. The common denominator is inflammation. So we've got to get the inflammation down. And now that we have this amazing 21-day raw detox, we want to get the waste out, you know? Recommend getting the waste out first and then getting them on the CBD. But I can't think of anything where you would recommend one product. You need to layer the products. So that person really, the average person really needs to be on the tincture, probably the topical, and the gummies. And what I've been doing at night, there are some nights where I will take the Power Extreme Pain Cream and rub it on my trigger points, those areas behind the neck, shoulder, lower back. You know, when you're trying to go to sleep and you're just tense, with that Power Extreme Pain Relief, I don't have pain, but I'm tense, and it just helps me relax. So that's something new you may want to recommend to your customers, to use a little of the Extreme Pain Cream or even the Dr. Rita's Rub, just so your body can be relaxed as you're going to sleep.
Dr. Rita, this,
Awesome. Thank you, Dr. Rita.
oh, I'm sorry. Hi, this is Francine. Yes, I just wanted to add to what you were saying about the pain cream. I've spoken with people who've said that they feel so much relaxed using the extreme pain cream, and that wasn't the intent. You know, they just thought they were doing it for pain, and just it calmed them down significantly, and they were able to rest and relax.
I have to absolutely agree. And I'm like the chief medical officer. I was like, oh my God, this is amazing. Like, I will use it just for that relaxation.
Yes.
You don't have to use it for pain. So it's great, great, great. I love it. Thank you, Francine, for that share.
You know, there's another thing I want to share. I have a friend who had COVID, and she was sick for a few months and stated that she was just so foggy and could not really think well. She thought she was going to die, actually.
Oh, no.
And she was pretty sick. And she started using the Delta 8 gummies and said that it really has changed her life. She hasn't felt as clear for many, many, weeks. So she loves it, and it has made a significant difference for her.
That is very, very good. And
Yes.
I'm glad to hear that she is well and better. But
Yes.
COVID long hauler symptoms are really quite, they can be quite devastating. You know, you've survived the infection, but I have a nephew that I can't remember the medical term already, but they have a distortion in their sense of smell. So he didn't lose his sense of smell, but he has a distorted sense of smell. Francine, if you can look that up, you're really good for helping me look up terms. So when he walked into my house and I was making chili for him and my son, he's like, "What are you cooking? It smells like bowel movement." So their whole sense of smell is distorted. So much so that he's lost a lot of weight because the smell on most things smells horrific. It smells horrible. And so that, along with the hair loss, just a lot of long haulers, symptoms that can be devastating. So yes, that fogginess, I'm glad that's come back for your friend and loved one. So that's good.
I've got the definition. The word for the distorted sense of smell is parosmia, Parosmia.
Say it again.
P as in Paul, AR as in Robert, OS like Sam, MIA. Parosmia.
Yeah, parosmia. Yeah, it's real. So my nephew has that. And it's been 8 months already since his infection. Can you imagine that? Like, you can't even eat because it smells so bad.
No.
Any other questions?
Yes. Hi, Dr. Rita. My name is Naima. I'm
Naima.
really, 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 I'm really, really, really new. Dr. Betty Smith invited me, and I'm just getting started. And first of all, I really want to say thank you for your service to humanity. And my heart goes out to you, and I will absolutely be praying and sending you light and love. Thank you so much for everything that you're doing, standing at this time in history. Thank you. I have a question. I'm taking right now terbinafine for an antifungal infection, and I've asked a couple of the doctors that were involved, and no one could answer my question. I'd like to start phase 1, and they are monitoring my liver because it's one of those medications that can harm your liver, and I did do the blood work halfway through, and I was just wondering, would it be too taxing on my liver if I start phase 1 and maybe I'll be doing some detoxing, or should I finish the terbinafine first?
I would finish the medication first, and then I would do the detox, because the detox in phase 1 is just 4 days with your bitters.
Okay. So,
I recommend in phase 1, you do the 4-day of bitter first,
okay,
and then you move into your meal plan and your gummies and your coffee. So I would
but you said,
the
go
medication
ahead.
first, finish your
Okay.
medication first, and then start phase 1.
All right, thank you. I asked the pharmacist, nobody, and of course, that I'm just praying for medical, doctors or whatever that also look into holistic ways and alternative ways. Because basically they were like, "Why? We don't know what's in that product and this, that, and the other." So thank you so much. I've been asking for a couple of months now.
Yeah.
One more question. I just got had a biopsy done, and they said I have eczema, and I do have the steroid cream. As far as a regimen of the CBD products for inflammation and all that, just I asked the doctor. I said I'm about to start with CBD. And he's like, well, just be careful as far as whatever herbs are also involved. So I'm gonna need some help with that too.
Yeah, so I would recommend that you finish your medication.
Okay,
Then you're gonna do phase 1. The
Okay.
great thing about phase 1 is that you've got CBD in your coffee and you have CBD in your gummies. So that's a great thing, because when you're dealing with eczema, psoriasis, when you're dealing with such a systemic sort of rash, right?
okay,
You're gonna want to consume the CBD. So you're gonna be consuming CBD. It's going to start to reduce inflammation. It's going to help you reduce the weight. You're gonna get like more bang for your buck by doing the phase 1.
okay.
And you already have your cream. So I would recommend to continue using the cream for the eczema at this time.
All right. Thank you so much for. Thank you. Yes.
Good luck to you.
Oh,
And
thank
if you're on the line, please take my email address. You all are welcome to email me with questions. I'm going to put it in the chat. It's ritamd@wakana.com. I think I left my glasses in the car. I'm pretty sure. Amanda, did you ask your question? I'm brand new and could potentially be considered a guest, though I'm on a 30-day trial. My question is pure curiosity. Why is all the knowledge Wakana delivers only in video form? I'm watching the videos my coach sent and typing notes on another. Oh, can a girl get some written word? Yeah, soon, Amanda. Soon we'll have more written words. Any other questions? Great questions, you guys. Well, if no other questions.
I'll say something, Dr. Rita. This is Cheryl.
Yes, Cheryl, how are you? Cheryl, happy.
I'm good. I'm sorry I couldn't get on when you directed me earlier.
Oh,
but
no.
I just want to just say thank you, thank you, thank you. And I had hot flashes a while ago, like maybe 10 or 20 years ago. And one thing, if you having hot flashes, don't try not to eat sweet stuff, because that just brings it out more. I learned that the hard way. Even if you have coffee, don't put the sugar in there. Try not to. That is the main thing right there, sugar.
Yep, yep.
You are definitely, you own it.
I definitely can feel when there's hidden sugar in something I've eaten. I will have hot flashes. Outside of that, I don't have those symptoms at all. And Cheryl, you know, is a great example of really being patient. You know, we worked with Cheryl a lot in finding her sweet spot with the CBD as it relates to some of her challenges that she was looking to improve with CBD. So do not let your customers or family or friends give up. They've got to get the CBD to really get in a steady state in the bloodstream. And you really need to, after that, find that sweet spot where you start to see the results. And that may not happen in a week or a month. It may take longer. So it depends on your body chemistry. It depends on your weight. It depends on your diet. It depends on how you metabolize CBD. It all has so many different factors. So really encourage your people to stay with the program. And so the CBD, we can figure out the best amount and dosage for that person. So thank you so much. I really welcome all your prayers, not only for me, but for the staff here, for the patients. It is what you're seeing on the news is honestly absolutely true. We are overwhelmed. We are overwhelmed. They're literally our patients laying everywhere. So yeah, pray for all of us, and you guys be well, be safe. Hope to see you all on Saturday, which is our huge health conference. If you don't know about it, please ask the person that invited you. You don't want to miss our health conference. So we will see you next week. Goodbye, everyone.